At the end of the day, what we are is to help our patients through difficult moments. So I think for the young doctors out there, it's important to realize that indeed life can be difficult. Not everything is rosy in our job, in our career. There are going to be tough days, there are going to be dark nights, and sometimes you might feel like you're down in the trenches when things don't go as planned, patients become unstable.
Now, to succeed in this field, I think you need to have a strong sense of fortitude to whatever adversities that life might throw at you, and you need to really enjoy the grind. Long working hours, high stress environment, otherwise you will not be able to do a good job and to succeed. You have to get your objective right. Once you set your goal and objective right, the rest is secondary because you enjoy the grind.
But through it all, I think it's important to keep in mind that we are doing a world of good for our patients. There are lots of appreciative moments that I've had in my career. Patients come up to me and say, "Thank you very much for a job well done. Thanks for helping my dad through the tough times." And that keeps me going. At the end of the day, what we are is to help our patients through difficult moments.
I have to thank all my patients because they're really my teacher and they really give me a lot of inspiration and move me forward to handle the daily challenge. I see a lot of patients, they are really working very hard to make sure they can live. Even though it's a very tough subject, but I see there's a lot of reward in terms of patient outcome.
I envy the young doctors today because they have all the amazing tools, advances in medicine and technology they have at their hands today. Imagine if I was a young doctor and I'm thrown out into practice alone in a hospital without a mentor or super senior consultant to rely on. Now you have one, and it's called AI. And you use these things as a thought partner so that you will feel more reassured in your daily work if you use it the correct way. I think this is where, if they make use of available tools, they won't feel so fresh or inexperienced. They will gain knowledge faster and manage your patients better. But don't forget to work ethically and you won't stray. Okay? I think that's the most important advice I can advise young doctors. Work smart, but work right.